Hello, this is Dr. Hall, and now let's review the standards anatomical terms of locations used to describe anatomy and movements in humans. And the terms are often derived from Latin or Greek roots, and the terms describe something in standard anatomical position. The position provides a definition of what is in the front or what is in the back and so on. Um, Common directional terms include anterior and posterior. Anterior describes what is on the front and posterior describes what is on the back. We have a movement example in here using the word anterior, and the leg direction movement is anterior. Very similar to how we refer to superficial or shallow people. Superficial is a directional term used to describe things that are closer to the surface. For example, the skin is superficial to muscle, and deep on the other hands refer to the things that are closer to the inner core or the center. The skeleton, for example, is deep to our skin, or if we use our previous example, muscle is deep to the skin. Superior is a directional term that it's used to describe what is above, while inferior is used to describe what is below. For example, we could say that the head is superior to the hips, or that the knees is inferior to the hip, and in an anatomical position. Is here a way to to make the feet superiors to my head? There is a way. For example, if by doing a handstand, your feet are superior to your head. Next, we learn how to describe structures that are closer to the midline for body versus further away. The midline divides in the body in right and left halves. Medial describe structures that are closer to the midline or closer to the midline of another structure, whereas lateral describe something to the side of the body or something that is further away from the midline than another structure. This is a movement. How would you describe the position of the wrist as compared to the position of the shoulder? If you said the wrist is medial to the shoulder, you are correct. It could change this movement so that the wrist is a lateral to the shoulder, and of course in this movement the wrist is a lateral to the shoulder, but in both movements the foot is medial to the knee. Not to be confused in this part with medial and lateral. Proximal and distal is different, and proximal distance refers to the structure that are closer to the trunk or further away from the trunk. For example, if we look at the arm, the shoulder is at a point which the arm attached to the body or the trunk. Therefore, the shoulders will always be proximal to the elbow, and the elbow, as you can see here, will always be proximal to the wrist. However, the elbow is distal to the shoulder. Other commonly used directional terms include ipsilateral, meaning on the same side, and contralateral, meaning on the opposite side. For example, in this position, if I ask in this position to raise your ipsilateral arm, which arm will be raised? The right or the left? What do you think? If you said the right, you are correct. Unilateral refers to doing movements in one side, while bilateral refers to doing movement in both sides. For example, in this movement, how would you describe this movement? It's unilateral. If you said unilateral, you are correct. Another terms like prone refers to lying face down, whereas supine means lying face up. We present on the screen some examples of strength exercise in prone position in here. And finally, there are certain terms that are used to describe regions of the body. The arm, for example, refers to the region between the shoulder and the elbow. The forearm refers only to the region between the elbow and the wrist. So we finish with this topic of anatomical terms.